Keeping Britain at work has proved a challenge as Omicron has surged. New figures from the Office for National Statistics show 3% of the workforce was absent because of COVID at the end of last month. Now the Health Secretary has bowed to pressure to cut the self-isolation period in England from 7 to 5 full days.
From Monday, people can test twice before they go, leaving isolation at the start of day 6. 2/3 of positive cases are no longer infectious by the end of day 5. And we want to use the testing capacity that we've built up to help these people leave isolation safely.
Joe Mills owns 3 salons in Soho. A third of his staff have been off in recent weeks because of COVID, but he's not sure the new isolation rules will make that much of a difference.
It's test on the 5th day and then again on the 6th day and then come back to work if you're clear. But, you know, what percentage of people are testing clear on day 5 and 6? I don't know. You know, so, yeah, anything that shifts the requirement for quarantine is going to be a bonus.
According to the UK Health Security Agency, only 5% of people are infectious after the old self-isolation period of 10 days. Under the current rule of 7 days and 2 negative lateral flow tests, the chances of being infectious rises slightly to 6%. With the new 5-day isolation time and negative tests on day 5 and the morning of day 6, the chances rise again to 7%. Some scientists are sceptical about the economic benefit.
We know that many people will continue to test positive after 5 days and will continue to be isolating. Also, we know that many people don't work 7 days a week, so there will be some people who will no longer be isolating, but it will be on their days off. So when you actually try to look at the impact that it will have on the economy, it may be much less than is being hinted at.
Only 3/4 of people complied with the full 10 days of self-isolation. The hope of being released after 5 might help. It's a calculated risk.
The Health Secretary says boosters, testing and antiviral treatments will be crucial as Britain learns to live with the virus. But infection rates are still high, hospitals are still under enormous pressure, and there's always the chance of another variant.
In another sign that life is moving on, Professor Sir Jonathan Van Tam is leaving his role as a government medical advisor. There were no tortured metaphors from him this time, just a wish that COVID had never happened. Thomas Moore, Sky News.